Home listening, of course, on the AM 870 app. And, of course, your at-home smart speakers. We thank you for joining us. The schedule has changed, no doubt, turned upside down. And that's one of the critical components of the feeling about all of this and the existential kind of, well, I'm not doing stuff literally the way I used to do it. And that's
right.
Unsettling before we get to any virus or any infection or any bug, right? Mm-hmm. And that makes it hard. And we adapt to that. Most importantly is preventing the illness, the sickness, the infection called COVID-19. That's, we'll ask Dr. Eisenberg, the cardiologist from right here in Burbank. My understanding is that's the disease, and the disease causes the coronavirus. And that's what America and the world are battling in this unprecedented shutdown, if you will, of our daily lives as we typically lived them before this, some 3 weeks ago. Dr. Eisenberg is with us on The Morning Answer. He is a cardiologist, and we say good morning. Nice to talk to you, my friend. How are you?
Very good, thank you. Thanks for inviting me.
Thanks for being with us. You come highly recommended, actually.
Yes, you do.
So we appreciate you taking the time.
Oh, my pleasure.
Dr. Eisenberg. Yes, go.
Yes.
No, you please go right ahead. I was going to ask, as a medical professional, doctor, and you've been here in the Valley for a long time. Obviously, our doctors, our nurses, our healthcare workers on the front lines of battling COVID-19. If I may, when you make those decisions about your office and who comes in and who's not there and what patients should come in and who is better off to be home, that's a challenge, or is it not?
It's a huge challenge, and it involves whether you're in a small office or a large office with 10, 20 doctors, or even if you have an emergency room, who should come in and who should not come in. I think the first and foremost thing is communication with each other, learning as much as you can. The big aspects of this disease are its infection rate, and it does happen when you're close to each other, when somebody coughs, even it can come from breathing. So the most important part is to know when to come in. If everybody comes in with a cough or shortness of breath or something like a headache and a fever, we're going to be stocked with patients in the emergency room, and nothing will get done, and everything will get contaminated. So what doctors are doing primarily is trying to isolate who comes in. A lot of telephone calls.
Mm-hmm.
Where most practices are switching not only to phone calls, but to phone calls with a video component. But then that requires the person on the other end of the line to have a video component with something like Zoom or FaceTime. Some of the issues involve compliance with national rules about privacy and so on. So most of these things have to be handled with the doctor. But the most important thing is not to panic. If you have a cold, you don't race to the emergency room.
Well, let me ask you that question, Dr. Eisenberg, because this is, I think, something that's affecting a lot of us. We're all hypersensitive right now. Everybody's, thinking about every sniffle, every cough, every sneeze. But it's also, at least for me, I hope, I suffer from allergies. And I feel like over the last several days, I've been noticing the symptoms that I always do this time of year with the runny eyes and the sneeze. But of course, you're being super sensitive. So what are some of the symptoms that when is it time to seek medical attention, whether that's a call to the doctor or a call to go to a trip to the emergency room?
Well, I think, first of all, what you're saying about the allergies, you're absolutely right. If I haven't seen 10, I've seen upwards of 50 patients in the last week who are complaining now of allergies, nasal problems, sinuses, and so on, and yet they then remember they have it every year.
Right.
A fever is a big item. If you check your temperature and it's high 2 or 3 or 4 days in a row or
mm-hmm.
spiking, that's something different than an allergy. And that's something then with a sore throat or with a headache
mm-hmm.
or with a cough that you still don't go to the emergency room because you're going to be isolated anyway.
Right.
You know what I mean? We don't have a treatment. We don't have a medicine.
Right. But you can make the call to a medical provider.
Yeah, you can make the call. It might be difficult, but I think the main thing you're going to get, it might not satisfy you, is to stay in place.
Right.
And if things start to get really bad, and that means you're struggling to get air, you can barely stand because your lips are getting cold, your fingers are, everything's getting to the point where you can't lift yourself, then you get in. But very little's going to be done if you just go outside and it can even get worse because you might get a worse strain or something else if you
Let me
don't
ask you,
have it.
Dr. Eisenberg is our guest from Burbank. He is a cardiologist, and we're talking about COVID-19 and coronavirus, and specifically here, some of the symptoms, some of the early warnings. Now, Dr. Eisenberg, take us. I'm asking you to take us back to high school or junior high biology. Here's what I'm no cardiologist. Here's what I know. In the body, the heart is in the middle, and around the heart is the lungs. Am I wrong yet? Because I know I get wrong. I'll be wrong at some point.
You're totally right.
Okay,
totally right.
Thank you, doctor. So the lungs, of course, one of the components, or one of the often heard telltale signs from folks who have endured symptoms of coronavirus is that respiratory distress that you describe. And I think that was a very sort of illuminating moment where you described trouble catching one's breath, and then sort of what feels like that more severe situation. And I wonder, the lungs, the respiratory, the difficulty breathing, do some people turn up testing positive who don't have the trouble breathing? It feels like from the media that doesn't happen, that the respiratory stuff is always in there. And I know it's never always, but you understand the general question.
Well, here's the thing. Most 80% of people who are getting the illness are coronavirus positive. We haven't been testing very well for the last few months. Now it's starting. There's in the offing are some 5-minute and 45-minute potential tests, but in general it's taken 3, 4, 5 days to get the answer. So in general, most people who are corona positive that you see on television, even newscasters and so on, talking, they're not having shortness of breath or cough. But if they turned into a fever while you were watching or not, if they turned into such shortness of breath that they can barely get their air, that's when there is no question that you seek urgent help.
Sure.
The question is, if we have this peak, which everybody's talking about, we're going to be overrun.
So better to stay home if you can.
Stay home if you can, but if you can't, then the first move is to a hospital. But you got to realize you're coming into a war zone.
Sure.
And the families then can't be with their patients with their family.
Dr. Eisenberg, we're up against a break. We've got about a minute left, but I want to ask you a two-part question, and I know this is a tough one. The first one is just to chime in on your opinion whether or not people should wear masks to the grocery store, to the bank, and then part two of that, do you feel optimistic about the hydroxychloroquine and Z-Pak combination to treat coronavirus patients?
Okay, number one, there's a lot of debate, and the CDC is about to turn its angle on this one. I would say if you're going into a store, I would wear a mask, any kind of mask, or a doubly turned a bandana, or something with a little heft. Even if that's all you got, something with a little heft. Number two, the chloroquine, zithromycin thing. Right now, as far as I'm concerned, even though there were 20 patients that were studied, which is not a study, is a complete hoax as far as I'm concerned. Now we'll see. But right now, the chloroquine and Zithromax is required for people with real conditions that have a real indication.
Okay, Dr. Daniel Eisenberg is a cardiologist right here in Burbank. Thank you, doctor, for joining us.
Thank you so much.
On the Morning Answer, we will continue here with our check-in. We'll talk to you about how you're doing today on a Wednesday. We'll plan it out, and we'll chart it out, and we'll get through it together. That's why we're here. It's Brian and Jennifer on your Morning Answer. We continue